unfortunately. So welcome everybody. This is another of the Dorset Macmillan Cancer Information Project webinars. Today's topic is radiotherapy, and I'm delighted to be able to introduce Mandy Sydenham and Zoe Greenfield from the Dorset Cancer Centre radiotherapy team. They are part of University Hospitals Dorset and based at both Poole and Dorset County Hospital. So without further ado, I'll switch my microphone and camera off and I'll hand over to you, Mandy. Thank you.
Good afternoon, everybody. Welcome to our talk this afternoon. So I'm going to hand over to my colleague Zoe, who will begin the talk. Can we have the next slide, please, Vicky?
Hello, so my name's Zoe. My job role in the department is the quality manager. So part of my role is looking after service improvement and patient experience, which is why Mandy's asked me to help her today with today's information that we're giving. And then Mandy's one of our Macmillan review radiographers who will go on to a bit more detail into the actual patient care side of radiotherapy. So I'll start with a brief introduction into what is radiotherapy. Next slide, please. So in this session, we hope to cover what radiotherapy is and how it works. What's a typical pathway for a patient that's going through radiotherapy? What are the types of treatments that's available in radiotherapy? And alongside that, the common side effects and how we manage them as a team. So just to sort of start off and just break the ice a little bit, we've got a little bit of a quiz. I don't know if anyone has a pen and paper, write your answers down. We'll go through the answers at the end. So hopefully we'll answer these questions throughout the presentation today. So they're just true or false. So number one, radiotherapy makes you glow in the dark. So again, just true or false, and we'll go through these at the end. Number two, you cannot see or feel radiotherapy. Number three, patients receiving radiotherapy must stay away from pregnant women and young children. Number four, patients normally have planning and treatment on the same day. Number five, radiotherapy only affects cancer cells. Number six, patients will all experience the same side effects. Number seven, radiotherapy will make you lose your hair. And the final question, number eight, nurses give radiotherapy. So hopefully throughout the presentation, we'll clear some of these answers up and then you can review your answers at the end and see how you got on. So next slide, please. Lovely, thank you. So what is radiotherapy? So radiotherapy is the use of high energy radiation, which is usually X-rays. So similar to when you have diagnostic X-rays, apart from we use higher energy. And the treatment for radiotherapy can either be given radically, so we aim to cure the cancer, or palliative, where we aim to improve symptoms related to the cancer. Radiotherapy is sometimes used on its own, or it can be used in a combination with other treatments, such as chemotherapy, immunotherapy, or as I mentioned, just given on its own. So although radiotherapy doesn't get much of the news, 1 in 4 people will actually need radiotherapy at some point in their life. So it is quite a common treatment in relation to cancer treatment. And 40% of the cures are thanks to radiotherapy, either on its own or combined with the other treatments that we've already mentioned. Even though it is a big part of the cancer treatment, only 5% of the entire cancer budget is spent on this type of cancer treatment. So in terms of improving the techniques that we use, the budget for that is very small compared to how many patients we treat. So modern radiotherapy is precise, cures more patients and produces fewer side effects. So The improvements in radiotherapy have seen a drastic improvement in the last couple of years even, and it's improving all the time through research and trials. So here in Dorset, we have the main radiotherapy department, which is based at Poole Hospital. We have 2 CT scanners there and 3 treatment machines. And then we also have a satellite centre, which is based at Dorset County Hospital in Dorchester, which we have 1 treatment machine. Next slide, please. So radiotherapy is delivered using a machine called a linear accelerator. So we call those LINACs for short. And we've just got a little image here which sort of demonstrates the starting point of radiotherapy. So this is where it all began. And then the next slide will show you where we're at now. So this is one of our treatment machines. I think this is the one that we've got based at Dorchester. So this was 2019 it started, so it's still one of our new machines, and we have 4 of these all together based at the Dorset Cancer Centre. So you can see the vast improvement in the machines. So who works in the radiotherapy department and who is part of the radiotherapy team? So there's lots of different parts to the treatment, which involves lots of different members of staff. So we have the clinical oncologists who initially see the patient and refer the patient on for their treatment. We have the therapy radiographers. They're involved in planning and delivering the treatment of the radiotherapy. We also have physicists, clinical scientists, dosimetrists. They're all part of the planning of the treatment, QA of the treatment machines, as well as the radiotherapy engineers who regularly service our machines to make sure that they're performing at the best. And then we also have healthcare assistants and receptionists within the department who help maintain the running of the department and seeing the patients on a day-to-day basis. So in terms of delivering the treatment, therapy radiographers will deliver the treatment using the LINACs. So they'll work in a team, they'll never work on their own, but they're delivering the treatment that's been decided by the clinical oncologist. So in terms of being a therapy radiographer, that involves managing the treatment pathway, providing the technical expertise and support while delivering the treatment. So that can include side effects from treatment. Also, if a patient struggling in terms of their diagnosis, we can refer on to the correct places. So we work in quite a big team with lots of other members of the team, such as the CNSs, counsellors. So we're involved in quite a multidisciplinary team. So as therapy radiographers, we all have the expertise in the relevant technologies, and we've done a separate course which is based on radiotherapy and oncology. Next slide, please. So how does radiotherapy work? So the radiotherapy is planned to target a specific area. So unlike chemotherapy, where that's delivered into the bloodstream and can travel around the whole body, radiotherapy targets just that one area that we're looking at. So in terms of the treatments delivered to the optimum radiation dose to this area and trying to keep the dose as minimum as possible to the area surrounding it. Next slide, please. So in terms of the actual radiotherapy itself and how it works, so the radiation can damage the cells as part of the cancer cells. So it can either directly damage the DNA or it can trigger formation of reactive molecules that can then be damaged. So in terms of the cancer cells, they're unable to rebuild themselves, but the surrounding healthy tissue, they can help build themselves. Now, the reason we get side effects from the treatment is because of the damage to the healthy tissues, and Mandy will go into this a bit in more detail a bit later on. Next slide, please. So, as I mentioned, the radiotherapy has to go through the healthy tissue, which is why we get the side effects, but these healthy tissues can build themselves. So, because of the damage to the cells, we give the radiotherapy across a number of sessions. So these sessions can vary from 1 up to 30 treatments, and we deliver them Monday to Friday, giving the weekend off, which allows the healthy tissues to recover. So again, as I mentioned, the side effects are related to the damage to the healthy tissue. And I will hand over to Mandy to go on more into the treatment.
Thank you, Zoe. So when we talk about radiotherapy, we talk about two main types. There's external beam radiotherapy and internal radiotherapy. Now, for this presentation, we're mainly focusing on external beam radiotherapy. When you're referred for external beam radiotherapy, you may hear various types of radiotherapy terms used. Things like conformal, intensity modulated radiotherapy or IMRT, image guided radiotherapy, stereotactic radiotherapy, but these all refer to different treatment techniques, and basically the use of the machine differs in each of those cases and how we actually perform the treatment, but the outcome is the same. We also consider superficial radiotherapy to the skin in this sort of same class of external beam radiotherapy. Now, the picture on the right with the lady with the small machine is a superficial machine. This doesn't penetrate so deeply and only goes into the layers of the skin, so is ideal for treating skin cancers. Or we can also use electrons on the main LINAC machines, which also don't penetrate so deeply. Now, lately, there's been a lot of information in the media about proton beam therapy. It's still not widely available in this country. I think there's only about 3 centres, but the other picture shows a proton beam machine, which is very useful for some specific cancers, i.e. brain tumours. So if I could just have the next slide, please. So then we go on to internal radiotherapy. We have brachytherapy, which is actually the implantation in surgery of actual radioactive sources. So the image here shows an applicator going into the cervix and the endometrium to actually put a small radioactive source into the cavity to provide a high dose to tissues without then going through healthy tissues. The other internal radiotherapy is radioactive liquid treatment, or radioisotopes or radionuclides, which are injected into the bloodstream and then target specific areas. A particular one for this is thyroid cancer. With these treatments, the patients will actually be radioactive for a specified period of time. So now we go on to the radiotherapy pathway. When a patient gets referred to the consultant, they're seen initially by the consultant and then a referral is made to the department. The first thing that has to happen is the planning of the treatment. And this is done with the CT scanner, which is based at Poole Radiotherapy. The data then taken from the scans is sent to physics for planning to produce the scans and the plan in combination with knowledge from the doctors on outlining structures and outlining the area that they want treated. The plan then is inputted into our treatment systems. Now, often people think that once they have their planning, radiotherapy is going to occur straight away, but this part of the treatment is incredibly complicated and takes a lot of time to plan safely and precisely. So sometimes, depending on the complexity of the treatment and its intent, it can take to up to 4 weeks before a patient is able to start their treatment. Next slide, please. So once we have all the data in place, we then give the patient a new patient chat. So this is a phone call to go through everything with the patient, talk about potential side effects, give them opportunity to ask any questions and go through what's going to happen with them on the first day of treatment. We also then check consent and make sure they're happy to go ahead. On the first treatment appointment, everything is explained to them very carefully. We do additional checks to make sure that quality assurance is adhered to, so things like the radiation dose is correct. We take X-ray pictures or cone beam CT scans on treatment to make sure we're in exactly the right position. making sure that everything is just perfect on the first day. Now, most patients will have a course of radiotherapy and each day will be the same. So once they get used to the treatment, they know what to expect when they come in for their treatment. On some occasions, we will just give a one-off treatment of one radiotherapy fractionation, and this is for people with mostly bone pain, and it's been proved to give us a high dose in one treatment is very effective to help with reducing pain for those sort of patients, but generally most people will have a course of radiotherapy. During that course of radiotherapy, there is continued assessment of the patient. So they'll have on-treatment reviews with people like myself who will look at how they're getting on with the treatment, offer any support, and also just generally give them support psychologically and help with any practical things that they might need through radiotherapy. And then once the course of treatment is finished, there generally tends to be a time frame of about 4 to 6 weeks, sometimes a bit longer, depending on what we're treating, until the follow-up appointment. Next slide, please. So once the treatment is going to start, the patient comes into the treatment room and is greeted by the team of radiographers, who they'll get to know quite well if they're going to be on treatment for 3 or 4 weeks. We assess them daily and ask how they are. And then we also then position them very carefully on the treatment couch. Now, this can be sometimes quite a long procedure to get them in exactly the same position as when they were planned. We'll use specialist equipment to make sure that they stay nice and still for us. So things like head shells, we've got footrests, we have special bags called vac bags that mold to the patient's shape and that stay like that for the whole of the treatment, so we can get them in exactly the right position. And once the team is happy with the treatment position, they leave the room, but we are watching the patient at all times. We've got cameras and we've got intercoms, and the patient can stop the treatment at any point if they feel uncomfortable or unhappy. We also can play music to put the patients at rest and ease. So if they'd like that, they can request that. That's not a problem at all. So prior to actually starting the actual treatment, we often will take some imaging. Now, by imaging, we mean X-ray pictures or CT scans. Now, these just verify the position of the patient on the machine in accordance to the plan from the doctor. So a lot of people think that we can actually see whether their cancer is responding from these scans, but what it purely is a measurement of position for us to make sure we're giving optimum accuracy. Next slide, please. So then, once we've decided that the patient is in exactly the right position, the treatment begins. Now, you don't see or feel anything with the radiotherapy, but the machine does make a bit of a loud humming noise when it goes on. It can make a few clanks and funny noises, but that's all very normal as the machine gets into position. And we monitor the patient throughout. We actually have some very specialised equipment now that enables the accuracy and safe delivery of the radiotherapy to be even more increased. And it will actually hold the beam of radiotherapy if it detects the patient is moving out of the position they need to be in. Now, treatments vary from person to person, and that's the most important thing about radiotherapy, is that they are individual plans. So whilst somebody may be receiving one type of treatment and a different time frame and things like that, this is all individual to that patient and their set of circumstances. Some patients, the pelvis patients, for example, will be given instructions to follow prior to the start of the treatment. So things like having a full bladder and having possibly sometimes enemas to have a less full rectum. But we will coach the patients and make sure that they are happy with the instructions prior to starting the treatment. Once we deliver the treatment on that day, the patient is able to leave straight away. There's no hanging around to making sure that they're okay. They'll be absolutely fine. The patient is not radioactive when they have external beam radiotherapy. So unfortunately, they won't glow in the dark. Next slide, please. So what about the side effects? Well, these are relative to the total dose and the number of treatments that a patient receives, and they're also dependent on the area that's being treated. As I said, with the planning and the treatment, it is individual to each patient. So whilst one patient might struggle with side effects, somebody else may find that it's not too bad and they're coping very well. So the radical techniques, the ones that are aiming to cure, have higher doses and therefore have potential for some more side effects. The palliative techniques are for symptom release, so they have lower doses and therefore have potential for less side effects. Now, the important part of radiotherapy is the actual side effects will continue working 10 to 15 days after the end of treatment. That's when they reach their peak. So actually, whilst the patient might be finishing with us, they still can have problems for a little while after. Next slide, please. So one of the main side effects, which is the only systematic side effect that we have in radiotherapy, is tiredness or fatigue. Now, a large proportion of patients will get some degree of tiredness. When we talk about radiotherapy reactions, we talk about them coming in about the second week of treatment, but they can last, particularly fatigue, for several weeks and months afterwards. The advice that we give is to rest, but to balance this with gentle exercise because it increases energy and keeps muscles moving. So we always say a nice brisk walk a day, and just to try and help with any problems with fatigue. We'll look at sleep patterns and we'll encourage self-management with a diary to highlight the best and worst times of the day. We ask them to drink well and to eat well as well. Also, there are specialists out there, so like the Macmillan helpline and the Prostate Cancer UK have dedicated fatigue nurses. So we'll signpost our patients to those services as well. Next slide, please. The other reaction that a lot of people know about is a skin reaction. Now, with the advent of the modern machines, the skin's reactions now are extremely a lot less than they were before. Generally, most patients will have a varying degree of a skin reaction. Now, again, this will depend on the dose that is given for the radiotherapy, the area that we are treating, the patient's lifestyle. So things like if a patient smokes, that can make things worse with your skin reaction, and genetics as well seems to have a little bit of an impact on it. So to start with, it looks and feels a bit like sunburn. So the area can get a little bit pink and then it can get a little bit itchy and a bit hot. And then if they're going to get any late-term side effects, they can get very tiny blisters that sometimes can open up. But the radiographers are specialised in advising specific creams and dressings if they're required. So there are some do's and don'ts with the skin during radiotherapy. We ask all our patients to moisturise regularly from the word go. So a couple of times a day, just to keep the skin nice and supple. We ask them to wear loose clothing and avoid extremes of temperature. We try and reduce on friction by asking to gently wash the areas and just pat it dry. Now, if we're treating the face and gentlemen want to shave, then we do ask them to use an electric shaver and don't do a wet shave at all. We have to be careful about adhesive tape in the area and we like to minimize sun exposure. So during treatment, definitely don't sit in the sun or expose that area to the sun. And then after treatment, for quite a while, we ask you to use a high SPF sun cream. Next slide, please. Okay, because of the varying types of side effects depending on where you get treated, I've just concentrated on some of the general ones here. So at the top is bowel changes. Now, if you're having your pelvis treated radically, there is a chance that you may get a difference in your bowel movements. Now, generally, it tends to be heading towards looseness, but sometimes some patients do find they get a little bit constipated. So we manage them depending on how they present, mostly with changing diet. And we actually go against every healthy diet you're ever told whilst you're in the NHS, and we reduce fibre to give the bowel a rest. If this doesn't work, we turn to medication. So nausea and vomiting only tend to occur if we're treating over structures like the stomach or over the esophagus, so upper GI tract. So we will manage this with medication again. Also, things like peppermint tea and ginger are very good for sickness. So urinary problems, again, when we're treating the pelvis, particularly prostate gentlemen, can often have quite a lot of problems passing urine, getting up in the night, and we do manage that with medication like tamsulosin, which does help. And we just talk to the patients and treat them on an individual basis and see what needs we can help them with. So when we're treating chest patients, we may cause some more breathlessness. We may cause some coughing and also bringing up of some nasty sputum, and sometimes that does have blood in it. But all of this is normal with the radiotherapy, and reassuring the patient of its normality is part of the job. We also monitor people's weight, because with cancer treatment, sometimes you can lose weight, particularly if we're treating the head and neck. We work in combination with the clinical nurse specialist in making sure that the patient is seen with the appropriate advice. And we try and encourage patients to have a good diet whilst they're on treatment. Next slide, please. So, in summary, radiotherapy is a proven and essential treatment for cancer patients. There are many types of radiotherapy, although the majority of patients will have general external beam radiotherapy. Each treatment is planned specifically for an individual. A team of radiographers alongside support staff will ensure a positive and supportive environment and will help with any needs patients may have during their visits. And this is really important to us. It's not just about the treatment, it's about treating the patient as a whole. The treatment does have side effects, but advice can be given to manage these. And radiotherapy is an ever-evolving treatment using state-of-the-art technologies to provide accurate, precision, and safe radiation delivery for the benefit of many patients. Next slide, please. So I put some further reading up here. Now, these are sort of the main websites that have got good information on them about radiotherapy. The radiotherapyforlife.org has a very good video on there about radiotherapy. And the others, I've chosen Prostate Cancer UK and Breast Cancer Now because they're the two main websites that I deal with, but they are both very good as well for information. Next slide, please. So I'm going to hand you back to Zoe now, and she's going to give you the answers to the quiz.
So back to the true or false quiz. So we'll just go over the answers. So radiotherapy makes you glow in the dark. That's false, but as Mandy mentioned, that would make things very interesting. Number 2, you cannot see or feel radiotherapy. That is true. So it's completely painless, and as mentioned, all the patient can hear is just the machine sort of making a buzzing noise as it's switched on. Number 3, patients receiving radiotherapy must stay away from pregnant women and young children. So this is false. In terms of external beam radiotherapy, there may be different advice given for patients that are receiving the internal radiotherapy. Number 4, patients normally have planning and treatment on the same day. So again, that's false. Unless it was a medical emergency, then they would be planned and treated on the same day. But in most cases, you have the planning scan, and then there's a couple of weeks in between while all the physics team do all the nitty-gritty parts of getting the plan correct for the patient. Number 5, radiotherapy only affects cancer cells. So that's also false. So it affects all cells. It's just that the healthy cells are able to rebuild themselves, and it's the damage to those healthy cells that cause the side effects. But the cancer cells are not able to reproduce themselves after the damage from the radiotherapy. Number 6, patients will all experience the same side effects. Again, this is false. So depending on where we're treating, what dose we're using, it's all relevant to those. So everyone is different. Number 7, radiotherapy will make you lose your hair. So this is true and false. So unlike chemotherapy, some chemotherapies which will make you lose your hair, the radiotherapy you'll only lose hair in the area if we're treating that area. So if we were treating someone's brain, they may lose some of their hair in that area. Sometimes some of the breast patients may lose some of their armpit hair in terms of where the treatment's being delivered. And the final question, nurses give radiotherapy. That's false. So we are therapy radiographers, and we've done a specialist course in radiotherapy, which is a 3-year degree in radiotherapy and oncology. So hopefully the presentation answered all those questions for you. And the next slide, please. Thank you very much for everyone for listening, and we're open to any questions.
Fantastic. Thank you so much. That was really interesting, and it's amazing to hear how many people are involved in delivering radiotherapy to our patients, and how much skill and care is taking to make sure that people get the right treatment performed safely, and ensuring that people get really good support. There aren't any questions at the moment, but please do post any you have in the chat box. If you would like to speak, you can, although the meeting is going to be recorded. Did you see the question from?
Yes, we did. Yeah, certainly. We can forward that to you, Stephanie. That's not a problem at all. I take it, Vicky, you've got the contact details that we can do that.
Yes, there is one person showing on the chat, Jay, who I can't see the contact details for, but if I think everybody else I have the contact details for.
Okay.
But if you're at all uncertain, if you're happy to share your email address in the chat box, then I can ensure that all of the slides get sent out. It will probably be tomorrow. Okay.